This is going to be a shockingly quick basic review of shock and all the different types of shock. So shock is inadequate cellular energy production from poor perfusion or uneven distribution of blood flow. The heart, the vasculature, and the blood all work interconnected in like a sort of triangle, and if one of them fails, then they all basically suffer. There's two types of shock, circulatory and non-circulatory shock. Circulatory shock includes hypovolemic, cardiogenic, distributive, and obstructive shock, and non-circulatory types are metabolic and hypoxemic. Hypovolemic shock is the most common kind of shock that you'll find. It's a decrease in blood volume from hemorrhage, severe dehydration, or trauma. It also includes GI or urinary losses from severe vomiting, diarrhea, or polyuria. The shock state that the animal's in is dependent on the percent of volume that's lost. Less than 15% is considered compensated, 15 to 30% lost is early shock, 30 to 40% is moderate, and then over 40% is severe shock. It's important to understand that the compensation mechanisms that the animal has fail after 20 to 25% of blood volume is lost. So hypovolemic shock, the compensation mechanisms that can be put in place are triggered when there's a decreased blood return and cardiac output, and it's all driven by sympathetic activity. So vasoconstriction, increased ionotropy, and tachycardia will help increase the cardiac output. Fluid compartment shifts, so fluid will go from the interstitial and extracellular fluid into the intravascular fluid to increase blood volume. And then the RAAS activation system, which retains sodium and water, will activate to increase intravascular volume. So with compensation, the animal will have a tachycardia and normal blood pressure, and then if it starts to decompensate, you'll notice a bradycardia and hypotension. And if left untreated, you will have organ failure and death in that patient. So cardiogenic shock is the second type of shock. It's a decrease in forward flow of blood from the heart. There's cardiac specific kinds like valvular disease and cardiomyopathies and arrhythmias. Systemic specific issues like metabolic imbalances with electrolytes or acid base and certain drug overdoses that affect the heart can lead to cardiogenic shock. Distributive shock is from severe decreases or increases in systemic vascular resistance, so it leads to a maldistribution of blood. Causes include sepsis, hypoadrenocorticism, disrupted sympathetic pathways like spinal cord injuries. Obstructive shock is when the blood can't move forward and around the body. Causes are GDV, heartworm, specifically Cavill syndrome, pleural effusion, a pneumothorax, diaphragmatic hernias, and thromboembolisms. The other type of shock is the non-circulatory kind. We talked about hypoxemic and metabolic. Hypoxemic causes are from anemia or severe pulmonary disease, and metabolic causes are hypoglycemia, drugs, toxins, and inherited diseases. So now that we've covered all the different kinds of shock, it's important to remember that shock is anything that leads to an inadequate cellular energy production. You need oxygen and then perfusion of all your organs to help create energy. The blood needs to be able to travel around the body properly, so that depends on the vessels and the resistance within the vessels and if there's any obstructions. And then also the function of the heart. Can it pump properly and move blood forward? I hope that helped you better understand shock. Thanks so much for watching and good luck with studying. Like and subscribe for more videos and comment below what kind of topics you want covered.